If you feel like your bladder descends or comes out or your prolapse gets worse when you have an orgasm, then what you can learn to do is to drive your orgasm with your lower transverse abdominis muscle. So if you can start to practice your orgasm by facilitating that orgasm with contracting your lower abs, that is going to help give an up mobilization to the clitoris itself, which will be stimulatory. But also, what that does is it helps to lift up the pelvic organs before the pelvic floor fully engages, which allows you to have a much more enjoyable orgasm that you don't have to work as hard for. Now, if you are having trouble getting an orgasm and you feel like you have to work so hard or you have to bruise yourself for it, a lot of times that's because your pelvic floor is too tight. And if the pelvic floor is already tight and then having to contract more to build that orgasm, it makes that build very hard because you're already so contracted. But if we start from more of a relaxed state and more of an open state, then the build to get that orgasm can be a lot more enjoyable and can happen faster, and can just be a lot easier to attain. So there's a couple caveats here. If you get pelvic floor work done, you will definitely have better orgasms because you have more range of motion in your pelvic floor. You also have more blood flow and vasculature going to the clitoris and to the pelvic floor itself. And then also you learn how to use your lower abdominal muscles to drive your movements instead of your pelvic floor, which will enhance your orgasms. Also, side note, it will enhance all of your workouts because if you can drive your movements with your transverse abdominis muscle and not with your pelvic floor, then you are going to have more stability and in turn more range of motion of your pelvic floor and of your hips, which is going to give you better glute activation. So it is all connected, and if you want better orgasms, get more range of motion and learn how to use your lower transverse abdominis muscle.